So we stay with movement and exercise, and our next speaker, Dr. Holger Cramer, is an expert in yoga research. He's the research director of the Department of Internal and Integrative Medicine at the University of Essen-Duisburg and working there at the Clinic Essen-Mitte. And he will show us the evidence on yoga, which is a very hot topic. I think there is no gym at the moment which is not offering yoga courses. And how many of you have experience with yoga in the audience? I see a lot of hands going up. So Holger, you will have an experienced audience, and I'm looking forward to your presentation.
Yes, thanks a lot for the kind introduction, and thanks a lot for coming. Interesting thing is, I think it was mainly women raising hands and asking about yoga. It's a typical pattern, so men are a bit more reluctant to try it. I hope I might change this impression a bit. So I'm speaking about yoga from a clinical perspective as part of mind-body medicine. So what I'm actually speaking of is yoga as a kind of therapeutic intervention. And when I'm speaking about this topic, I normally have to start with a bit drawback because yoga actually is not a therapeutic intervention. So when we speak about yoga, what we normally have in mind is things like this. So-called asanas, physical exercise, physical postures. There are even more images in mind of people like putting the feet behind the head or doing the headstand or the handstand. So really difficult to execute exercise people normally have in mind, or at least what they have in mind is exercise. And exercise is an important part of yoga, but it's not the only part that's involved. So if we speak of yoga, we have to look at the so-called 8 limbs of yoga. And this interestingly starts with ethical rules and lifestyle advice. So yoga in its traditional meaning means that we have a specific lifestyle that adheres, for example, to non-violence, to a specific form of eating, and also to adhere to ethical rules. And then asanas, physical postures, are only one part, and they lead to more internalized forms of practice, like breath work, specific breathing exercise, and then concentration and meditation, with finally reaching so-called samadhi, the oneness with the object of meditation, or the oneness of the body and the soul, the oneness with the complete world. So the 8 limbs of yoga actually were invented to quiet one's mind and to reach a union of mind, body, and spirit. Or if you want to reach the originals from the Yoga Sutras of Patanjali, it's Yoga Chitta Vritti Nirodha. Yoga is the silencing of the modification of the mind. So what yoga originally means is a form of meditation. It can be a form of exercise, but it's meant with a specific focus to become a meditation in action. So yoga actually is not a therapeutic intervention. It is not a part of medicine. So thanks a lot for your attention. It was a brief talk. Now, of course, there is something we can talk about in this topic, and this actually is so-called yoga therapy. And yoga therapy has been defined as the adaptation and application of yoga techniques and practices to help individuals facing health challenges at any level to manage their condition, reduce symptoms, restore balance, increase vitality, and improve attitude. This is a definition by Gary Kraftzer, a very prominent yoga therapist in the US. So what this actually means is that when we use yoga as a therapy, we do everything we do as if we do yoga for recreation, yoga for spiritual practice, yoga for meditation, but we do it with a therapeutic purpose. And when I speak about yoga in the coming minutes, I do it mainly as a form of therapy. So what you do in yoga therapy is also those asanas, for example. It's breathing, it's also meditation. It might also be lifestyle advice, but you do it to improve health. And why am I speaking about yoga at the university hospital? Why does yoga matter? We already heard that about a third of the audience has ever done yoga. Some of them might have continued. And if you look around, actually yoga is everywhere. So there are celebrities doing yoga in every gym. As Claudia said, there are yoga classes. People are doing it on Times Square. This is International Yoga Day. but not only on Times Square, but all around the world. There are mass audience doing yoga practice. If you want to participate in that, it's June 21st. It's the International Yoga Day, and the Indian Prime Minister managed to have this recognized by the United Nations. So this is now a worldwide international official yoga day. So people are doing yoga. And if you look at science, if you look at surveys, you can see that in the US, the lifetime prevalence is about 13%. So 300 million US adults have ever done yoga. 20 million US adults are doing it at the moment. I don't know if there are numbers from Switzerland, but there are numbers from Germany, and about 3 million people in Germany are doing yoga. So also there, it's quite prominent. And if you ask people why they are doing yoga, interestingly enough, most people do it for health. Most people accept general health to improve, to cope with a specific condition, to improve their immune function, to improve their athletic performance, so have it as part of their workout, part of their athletic practices, even to improve memory or concentration. And very few people do it because it's a hype, because it's a trend. In a German survey, they have been asked whether they do it for a hobby, for a trend, and less than 3% said, yes, I do it because it's hip at the moment. So double this or triple it to have the real number, including social desirability, but mainly it's done actually to improve health. So, and if people do it because they think it will improve their health, I think it's worth to study it, and I think it has to be studied to see if actually yoga can hold the promise. And if you speak to researchers outside of complementary medicine, most people think there is not much research evidence for yoga therapy. And this has been true at least 20 years ago. So we have done a bibliometric overview of all available RCTs on yoga therapy, and there have been very few in the 70s, 80s, and even 90s. So there have been 1 or 2 a year on a specific topic some researchers were interested in. But together with the hype we see in the yoga studios and in the gyms, there also has been a hype in yoga research. And now in the US, there are loads of research money available to do that, not so much, unfortunately, in Europe, but there are some trials also from Europe, and now we have about 60 to 70 yoga RCTs each year published. If you look at what they are about, we can see that there are lots of yoga trials addressing healthy adults or the general population. There's mainly trials from India who look, for example, at sports performance, but also at things like improved memory, improved psychological function. But if you look at therapy, we see there is a huge variety of what has been studied. And this mainly is because the research groups are so different that do yoga research. So these are mainly single therapists who are interested, for example, in pulmonary disease, and they also are yoga therapists, so they do a trial on yoga for COPD, for example. But there's also now a common pattern, and the most commonly studied nowadays, interestingly, is cancer, more specific, breast cancer. And other things that are frequently studied are pain conditions. So I will focus today mainly on chronic pain and cancer. Start with cancer, and interestingly, it's really breast cancer. It's not so much other cancer types. And now with breast cancer, there's so much evidence. We've recently completed a Cochrane review on that. So they did a meta-analysis. And for those who are not so much familiar with meta-analysis, I explain it a bit. So those are trials that have focused on yoga compared to no therapy. So RCTs that looked at whether yoga is effective here to increase health-related quality of life. And those bars here show the effects of individual studies. And the little diamond here on the bottom shows the pooled effect. What we can see here is if this diamond does not cross 0, this means it's a significant effect. So if you compare yoga to no treatment, yoga is more effective in improving health-related quality of life, although it's a relatively small effect. The same is true, interestingly, if you look at fatigue. So there are lots of trials who have focused on effects of yoga on fatigue, And fatigue is really important in cancer patients. So it also is symptoms that last very long and can be really debilitating actually. And interestingly, if we look at studies comparing yoga to psychological interventions, we also can see that yoga commonly is more effective. So yoga combining physical exercise with psychological aspects seems to be quite effective in increasing health-related quality of life, reducing fatigue, and also reducing anxiety and depression. And it seems to be as effective as other forms of exercise. So if it's compared to walking, for example, to stretching, none of both seems to be more effective. So patients can choose whether they want to do conventional exercise or whether they want to do yoga. Beyond just health-related quality of life or depression, there are also more specific symptoms related to cancer. So if you have breast cancer, lots of patients need to take anti-hormonal treatment. They need to counteract estrogen because it's increased relapse risk. And those women can relatively early enter menopause, even in their 30s. And this can be really tough for a young woman to early enter menopause. So we have done a trial where we had a look on whether yoga combined with meditation can counteract menopausal symptoms in women with breast cancer. And what we did here was we combined classical yoga postures and breathing techniques with more Buddhist-based meditation techniques. So it was a holistic approach to have both exercise and meditation, and was on 40 patients, relatively small trial, relatively preliminary. But interestingly, what we found were effects that yoga and meditation reduced total menopausal symptoms. This is a total score, and it reduced it after 12 weeks of treatment, but still after 3 months after the end of the treatment. And this was also true for somatovegetative symptoms. This includes hot flashes, for example, for psychological symptoms, and also for urogenital symptoms. So yoga seems to be effective both during active treatment, during chemotherapy or radiotherapy, seems to be effective for cancer survivors, and also for more specific symptoms in breast cancer patients, like menopausal symptoms. Interestingly, in oncology, almost all randomized controlled trials on yoga have been either on all cancer patients available, so not choosing a specific cancer type, or on breast cancer patients. There's very, very few evidence for other cancer types. There is an older trial in 2004 by Lorenzo Cohen, a US colleague, who had to look on lymphoma, mainly focusing on sleep disturbance, and they found quite strong effect on sleep disturbance in lymphoma patients. We have recently done a trial on colorectal cancer patients who had completed their active treatment. And what we found was that we had no effect at all of yoga on health-related quality of life in colorectal cancer patients. And the same almost true for all subdimensions of health-related quality of life, just a bit on emotional. And we had some effects on anxiety and depression. So there seems to be very little effect of yoga in colorectal cancer patients. What might be the case, because if you have colorectal cancer and undergo surgery, you recover relatively fast. So this was in colorectal cancer survivors. Perhaps if you can implement it during active cancer treatment, you might have more effects here. Interestingly, in our trial, we also did qualitative interviews, and the patients said they really enjoyed participating in yoga. This was quite interesting because it were mainly not so young men who participated, so they were in their 50s, 60s, and they come from a more industrial area. So it's not really the normal yoga participant. If you look at surveys, the normal yoga participant is young, white, female, and well-educated. Those patients were mainly a bit older. They were not so well educated. They were male and they were chronically sick, but they really enjoyed it. But what they said is it did not help so much with their bowel symptoms, with their cancer symptoms. But they still improved, for example, their back pain. So yoga seems to improve health-related quality of life and mental health in breast cancer patients, both during chemotherapy, radiotherapy, and in cancer survivors. Interestingly, so far there's no evidence in metastatic cancer. There's no RCT really focusing on that. And the evidence for other cancer types is limited. So it does not mean it does not work in other cancer types, but there are way too few trials to really make recommendations here. Another really important focus of yoga from the beginning has been low back pain. This is not so surprising because if you look at yoga, it's the yoga asanas, it's a form of isometric exercise. So you really use muscles if you do the right yoga style. So it's not so surprising for most researchers and most clinicians that yoga might improve low back pain. And there has been one really groundbreaking trial published in Annals of Internal Medicine. And in this trial, yoga was compared to self-care, so more or less a self-care book, and to other exercise, mainly stretching, a back school, so what is normally recommended for low back pain. And this trial found that yoga really reduced low back pain, and it did it at the same amount as stretching. So again, yoga seemed to be equally effective as other forms of exercise. We have again done a meta-analysis here and more or less confirmed the findings. So again, this is the small diamond down here. And in the short term, directly after the end of the yoga intervention, there was a moderate reduction in pain intensity and also in back-specific disability. And interestingly, this still was true in the longer term. So the trials had follow-ups of 6 to 12 months, and there still was a moderate, small to moderate reduction in pain and back-related disability due to yoga. And if you compare it to other forms of exercise, effects were absolutely comparable. So yoga seems to be as good or as bad as stretching here. A few years ago, there was a trial from another US researcher, Rob Saper from Boston, and they did something interesting because they compared different doses of yoga. So they had participants do yoga once a week for 90 minutes or twice a week for 90 minutes. And depicted here are the changes in pain and disability. And this line here is once per week, the other line is twice per week, and they found absolutely comparable effects here. So it doesn't seem so much a matter of more often, but it's more a matter of doing something. So if patients can do yoga once a week, and they can really adhere to that, it seems to be already quite effective. In a trial we have focused on chronic neck pain. And if you look at the literature, not only for yoga, but also for other interventions, there is loads of research in low back pain. And chronic neck pain actually is not so much less prevalent, and it's at least as disabling as chronic low back pain, but there is very few research on that. So we did a trial, one of the first ones on chronic neck pain, and we compared typical yoga exercises from so-called Iyengar yoga to home-based exercise based on recommendations by health insurances. And patients did it for 9 weeks, and they also practiced at home for 10 minutes. And what we found here was comparably to chronic low back pain, reductions in pain intensity. So the red line is yoga and the other one is exercise, and there was a relatively strong reduction by more than 50% in pain intensity, and also a marked reduction in functional impairment. We also had a look at more objective measures of pain, and we looked at so-called pressure pain threshold. And you use this instrument here that looks a bit dangerous actually if you look at it, but the only thing you do with it is that you initiate pressure on different muscle sites. And patients are just asked to indicate when pressure change into pain. And anyone in the audience ever had neck pain? Not so many, okay, so you're doing quite a lot of exercise, obviously. So most people now or then have neck pain. If you ever had neck pain and you inflict pressure to your neck muscles, you might see that you easier inflict pain to this area compared to when you have no neck pain. So This means that the pressure pain threshold is lower if you have chronic pain in this area. And after yoga compared to exercise, we found an increase in pressure needed to inflict pain at these areas compared to when patients just did exercise at home. So it seems that also this muscle tension also is decreased if you do yoga exercise. We had seen before that with chronic low back pain, we not just have immediate effects if you do yoga in a class, but also have longer term effects up to 12 months. And we wanted to have a look whether this also is true with chronic neck pain and why this might be. I'll skip that. So we also did a 12 months follow-up after the end of the intervention. So we just followed up patients and asked them whether they still had pain and how strong this pain was. And what we found, interestingly, was that about 2/3 of patients obtained a reduction of at least 30% in their neck pain. So 12 months after they stopped doing yoga in class, they still had a reduction of 30%. And 1/3 of patients even had a reduction of more than 50%. And the 50% reduction really makes a difference for a chronic pain patient. This means that they can be more active, that they can reduce pain medications, that they can participate more active in daily life. So it seems to really induce a long-lasting change. So when we submitted this for publication to a journal, they said, whoa, you can induce 12 months reduction in pain. This seems to be a miracle therapy. They don't know what you're doing there, so they rejected the papers. They obviously didn't believe us. What we're really interested in is seeing why this might be so long-lasting. So we did a regression analysis to see what might influence, what might predict change in pain intensity. And what we found interestingly was that it didn't matter how long patients had pain. Doesn't matter what gender they had, how old they were. It wasn't even important how many classes they participated in during the yoga study. The only thing that mattered was whether they continued doing yoga at home after the end of class. So it's depicted here as a change in pain intensity from total resolution to double pain. And what's depicted here is yoga practice during the past 4 weeks. So it's also is pain intensity during the past 4 weeks compared to 12 months before, so before the start of the yoga trial. And if patients did not continue yoga, it was a random distribution from no pain anymore to double pain. But as soon as they started continuing yoga after the end of class, there was just one patient who had an increase in their pain intensity, and all other patients had a decrease in pain intensity. Not know what's wrong with this one, so perhaps we should follow up on that. But we found here a relatively strong relation of continuing yoga practice with reduced pain, and we had an R-square, explained variance of more than 20% here. So it's relatively strong. For a psychologist, 20% is huge. I was quite happy with that. So for chronic pain, not only for low back pain and neck pain, but also, for example, for osteoarthritis, for rheumatoid arthritis, for fibromyalgia, there is now quite good evidence that shows that we can improve pain and function and also mood and health-related quality of life. Effects are at least comparable to those of other forms of exercise, if we accept that yoga is exercise. And there seems to be no direct dose-response relationship, but, and that's a downside for patients and for you who want to reduce pain by yoga, you have to continue it. So it's not doing yoga once and then you're pain-free, but long-term effects depend on long-term practice. I think it's the same for all physical activity. And based on those findings, yoga is also now recommended, at least in the German national guideline for low back pain, as an alternative to other forms of exercise. And this is the message I really got out of this. Patients really have a choice whether they want to do resistance exercise, endurance exercise, or yoga if they're more into that. So now I've mainly spoken about clinical trials, and this of course is on clinical evidence, and I'm really a fan of clinical trials. I love clinical trials. Things are really easy in clinical trials, at least in those trials that have been done in the past. And things are really regulated. If you do a yoga trial, you look for the best yoga teachers available. You really choose the patients who participate, and you have them doing yoga in a protected environment, just practicing with other patients who have the same condition. They have a really, really good yoga intervention that is tailored just for them. I've once planned a trial together with a really important proponent in yoga in Germany, and she said if you do a trial, your yoga therapists have to have at least 15 years of experience, they have to have a medical background, they have to have worked with patients who have these conditions, they have to complete all education that is there on yoga and yoga therapy so that we can deliver the best interventions that is there. Then a colleague asked how many are there in Germany who can do that in clinical practice. She said, I think there are at least 3. So what we find in clinical trial most often is a really artificial evidence. So it's not really well compared, at least for yoga, to what is done in clinical naturalistic conditions. So what we have done to see whether yoga also works on naturalistic conditions is we have done a survey among patients who came to our hospital. We're a hospital for internal and integrative medicine, and we asked them before they started their treatment with us. And we asked them whether they were doing yoga and how often they were doing it. And we defined every patient who was doing yoga at least once a week for at least 30 minutes as a practitioner, and every other patient as a non-practitioner. And we built matched pairs. So we did a case control study here, and we compared 186 yoga practitioners to 186 non-yoga practitioners, and they were matched for age, for gender, for education, for their medical condition. As you can see, it's mainly pain, but also other medical conditions. They were matched for almost everything we could find except for yoga practice. And we asked them, we used standardized questionnaires on how their health is. And what we found is that those who were practicing yoga had a better general health status. So even one patient said that they had excellent health. And those are patients who were just admitted to a hospital to treat their internal condition. I'm not sure if I would do that if I had excellent health. And more patients in the non-yoga conditions had poor health. And this difference was significant. So overall health in yoga practitioners was better than those in non-practitioners outside the clinical trial. So those who were doing it at home, for whatever reason they did it, we don't know. And if we look at components of health, we found that physical health-related quality of life was better in yoga practitioners, but no difference in any mental components. What's quite surprising, because if you look at, for example, cancer patients, we have a relatively strong effect on mental health, on anxiety, on depression, and even if we look at severely depressed patients, we can still have an effect when they do yoga. So there seemed to be no difference between those doing yoga and those doing not. And we thought about why might it be. And one thing we came up with, when we speak about yoga, most people, even those who do yoga, might think we are mainly talking about physical postures, about yoga postures. And the active component to improve mental health in yoga, at least for the most part, seems to be breathing and meditation, not so much the physical postures. So we did another analysis and looked on patients who meditated at home, not during clinical trials. And we had 115 patients who meditated, whatever meditation style they used. Not as many as yoga, but still quite a lot. And we found no difference in general health between internal medicine patients who meditated and those who did not. They were equally healthy. And also we found no difference in physical health. So there was no difference in physical quality of life. But what was there was borderline lower depression and, interestingly, a higher life satisfaction. So patients who meditated and who had internal conditions were not healthier than those who did not meditate, but they were still happier with their lives. So to sum it up, if patients do yoga in their everyday life, they are healthier than those who do not. And if patients meditate, they are happier than those who do not. And whatever you do out of that for yourself, I'll leave it to you. Okay. So far, I need 5 more minutes? Okay. Thanks. So far, I have looked on the bright side of doing yoga. So if you do yoga in clinical trials, you found effects for cancer patients, for pain patients. You even find effects for severely depressed patients, for patients with internal conditions. If they do it in everyday lives, they are happier, they are healthier, everything seems to be great. But those of you who are doing yoga on their own, have any one of you, before starting yoga, thought about that yoga might kill you? None? Oh, too bad. Perhaps you should. Because there has been a broad debate, mainly in the internet, that came up with a book by Pulitzer Prize bearer William J. Broad. And he wrote a book called The Science of Yoga. And many of us are scientists, so we know something that's called science. It must be true. And what Broad wrote was that yoga actually can expose moves that can maim and kill you. So he and his publisher was quite good in advertising this book. Actually, it's a relatively balanced book. It's not a scientific book, but it's a popular scientific book. I think it has 12 chapters. 11 are showing the rewards of yoga. It's also called the risks and the rewards. 11 are showing the rewards, and 1 is showing the risks of doing yoga. The New York Times took up on this book, and they published 1 single chapter out of it. Guess which one? So they published the chapter on risks of yoga, and they called it quite balanced, how yoga can wreck your body. It's not called can yoga wreck your body, it's called how yoga can do that. As you see, it's done in a relatively strict and pure journalistic approach. And they came up with that yoga seems to be quite dangerous, and also have been picked up by other media. And it started a debate on whether you can still do yoga at all. Madonna stopped doing yoga, and other people stopped doing it because it's so dangerous. So I asked myself, perhaps you do too, is it really this dangerous if you look at the medical literature? And that's what we've done. We looked at case series and case reports that were published on dangers of yoga. So this is just cases, it's not randomized trials so far. And we came up with 76 published cases. So this is not so much. If you look at millions and millions of yoga practitioners worldwide, 76 published cases. This is anecdotal evidence. So there are, of course, much more injuries and adverse events, but only 76 are published. They were mostly musculoskeletal system, in fact. You can imagine if you do really strong yoga exercise, you can hurt yourself, can have hamstring injuries. The nervous system was quite often affected, mainly things like neuropathy and stroke. So if you do the lotus position, sitting in a crossed leg position for a long time, you can have neuropathy. What I found interesting were effects on the eyes, so mainly glaucoma worsening. I did not expect this. And this is because if you have glaucomas, you have an increased intraorbital pressure. And if you then do inversions, so for example, if you stand on your head or you do a shoulder stand or everything where your head is the lowest point of your body, you further increase intraorbital pressure. If you do it as a healthy yoga practitioner, it doesn't matter. But for a glaucoma patient, this really conversions the condition. This can lead up to blindness. So if you have patients who have glaucoma and they want to do yoga, it's totally fine. They should just not do inversions, no shoulder stand. Not surprisingly, what I have said before, headstand, shoulder stand, lotus position were the most common practices associated with injuries or adverse events. And most case reports, case series, did not report how patients ended up. They just said there was this injuries, these adverse events, and they did not follow up on that. Those who did follow up, there are 9 cases reported partial recovery, 1 case reported no recovery, and 1 case reported a fatality. So one case report really ended with the death of a yoga practitioner. So obviously yoga can kill you if you look at the medical literature. I brought the case report for you to have your own impression on that. It was published in JAMA, so a really high-ranked medical journal in 1969. And I'll just read it to you. It's called Fatal Air Embolism After Yoga Breathing Exercises, and you can find it in PubMed under this heading. And it reads, a 16-year-old girl was brought to a local hospital emergency room in the late afternoon after a collapse at a teenage dance. The sudden collapse followed voluntary mouth-to-mouth yoga breathing exercises with a teenage boy in a hall where the marijuana smoke was so thick you could cut it. So those who are doing yoga quite regularly, is voluntary mouth-to-mouth yoga breathing exercises with someone of the opposite sex a common practice? Okay, does anyone even know it? I'm asking every time and no one so far knew it. Perhaps it's some tantra yoga or things like that, not sure about that. But it's definitely not a common yoga practice. So the patient was brought to the emergency room. Unfortunately, she died 1.5 hours later. And toxicological studies revealed significant levels of barbiturates and also of antihistaminics. So it was a teenage girl in a marijuana-clouded dance hall doing some strange kissing plays with a boy under drug influence. But still, you can still find it in PubMed, for example, published in JAMA under fatal air embolism after yoga breathing exercises. So one thing is, yoga is not without risks, but you have to be careful even with JAMA articles. So a brief survival guide when you want to continue practicing yoga. And this is really important. I'm making a bit fun out of it, but yoga is not without risks. Whatever you do is not without risks. And if you do something like breathing exercise, like sports, it can't be without risks. Yoga should not be practiced as a competition. And there were 1 or 2 men doing yoga, and I always have to say it to my gender, it's not a competition. It's not about being the first in the headstand. It's about relaxation. It's about finding your own core. It's about doing something for yourself. It's not about competition. Beginners, of course, should avoid advanced positions. And this one is really important. Patients with glaucoma should avoid inversions. They can do everything else, but please no inversions. Patients with musculoskeletal disorders should avoid forceful or competitive yoga forms. So they can hurt themselves, they can increase or worsen their condition. And if it's not obvious, yoga should not be practiced under psychoactive drugs. Or to put it another way, if your yoga practice looks like this, perhaps it's a bit too early for the headstand. There's something called Shavasana, where you just lay down on the floor and breathe gently. You might start with that one. We, of course, also have done a meta-analysis on that, looked at RCTs. And what we found is that yoga actually was not more dangerous than any other form of exercise. There were no more adverse events in RCTs of yoga than of other forms of exercise, a bit more adverse events and injuries than with psychological interventions, but just minor adverse events, no difference in serious adverse events. And if you do yoga, that you might injure yourself minor a bit more than when you do counseling is also not so surprising. And also this was not printed in the New York Times, it was printed in the Time magazine, at least in the online version, so perhaps we might now have settled this controversy. Really brief summed up, yoga can effectively improve clinical conditions such as chronic pain, cancer-related symptoms, and some more, both in clinical trials and in everyday practice. There's no hint that it's just a specific yoga style that's effective, but yoga generally seems to have positive effects, and it's relatively safe when practiced mindfully. So for the clinicians, yoga can be used as an adjunctive intervention, so not instead of other forms of medicine, but as an adjunctive to it, plus other interventions for pain management, supportive cancer care, and some other conditions. Yoga practices should be adapted to the needs and possibilities of patients, so perhaps not every yoga class is good for every patient. And yoga therapists should have at least a basic medical training and experience in working with disabled patients. They should know what the condition of a patient is. And there definitely is a need for legal regulations of yoga therapy in Germany and in Europe, because almost everybody can say they're a yoga therapist. I can say I'm a yoga therapist. You can say I'm a yoga therapist. I'm just treating patients. So we need to have legal regulations on that. And we're still not there. Still, yoga has to be done, but if you do it, it seems to be quite effective. Thanks a lot for your attention.